practice more COVID controls. Health codes are no longer required to enter public buildings or intercity trains. How should we understand these new policies? And where will China prioritize its healthcare resources in this new phase?
Hello and welcome to World Insight with me, Tian Wei. China has recently announced 10 measures to further optimize its COVID-19 response, part of efforts to balance epidemic control with economic and social needs. The new measures include allowing home quarantine and reducing the frequency of nucleic acid testing, scrapping testing results, and health code requirements for entering some public places. So how efficient could the new COVID measures be? How is the world now fighting against Omicron, the latest variant? On these questions and more, let's loop in our panelists. I'm joined by, in Washington, Dr. Kate Tulenko, founder and CEO of Corvus Health. In New Haven, Chen, Associate Professor of Health Policy and Economics at Yale School of Public Health. Last but not least, in Hong Kong, Jin Dong-Yan, a virologist with the University of Hong Kong. Ladies and gentlemen, welcome to the program. I hope you are like me, all in good health today.
Yes, thank you.
Thank you. It's good to know. We see the changes of policies in China concerning Omicron. We see gradually opening up rather rapidly, shall I say, in the past couple of weeks. So how do you see this process? Chen, would you like to go first?
Yeah, China released COVID restrictions rather quickly. This is out of the very surprising to many of us. And I think there are several things happen make the policymakers to decide such a quick reopen. The most important thing is the COVID variants becoming more transmissible as cases mount. Continue the draconian COVID measures no longer very effective. So why keep the virus infection, the transmission at bay, disruptions to people's livelihood, economy, and the society becoming more and more important. That's the consideration.
The latest information is the scrap off of the so-called green code system. That, of course, is the system that they use to track people's PCR test results and also to track where they originally come from. So we also see other measures. For example, pay for your own test, PCR test in some parts of China. This is not mandatory anymore. So, Chen, if you could, regarding the specific measures, could you give more comments?
The shift of the policy is towards giving more resources for protecting, especially those vulnerable population, older population, and to flatten the curve. So I think that's the most important thing. So those institutions set up during the pandemic, like the health code and the other APPs, may no longer be the attention being paid in order to prioritize those resources for more vulnerable population. So I think that there's a shift in the policy focus.
Dr. Jin, your thoughts?
So I think that I agree with Xi that this is a bit surprising, and I do feel they should prepare for these better. And most importantly, they need to educate the general public to explain the rationale of the new measures, and also to vaccinate the elderly very quickly, and also to stockpile effective antivirals, and most importantly, to protect the hospitals from collapsing.
At this moment, on Friday, for example, Jiao Yahui, the director of the Department of Medical Affairs from the National Health Commission, have been talking about the country is likely to rush to provide doctors and hospitals with more resources. We also see that there has been a lot of advocacy for vaccines for the elder generation. So, Dr. Tulenko, how do you see these changes?
As China is opening up and removing the restrictions, we are going to see, and we have already started to see a surge. And China has announced a new initiative to try to vaccinate even more of the elderly. I'm not sure if they'll be more successful. The vaccines have been around for 2 years. I think any elderly who haven't already been vaccinated aren't going to be vaccinated because they're not interested in receiving it. And I do think that China just needs to do the best it can to put up clinics, put up hospitals to help take care of all the people who are sick. One of the big challenges now is the BQ1 variant, which is circulating, is resistant to a lot of the antibody treatments, and also is a little bit more resistant to some of the vaccines as well. The vaccines aren't as effective against it.
It seems that everybody is having their own version of challenges. Dr. Tulenko, I understand there's a combination of challenges. For example, in North America, about the seasonal flu combined with Omicron. So how do you see that version of challenge for the US, for example? What are some of the latest measures?
The crises that we have in the US is due to COVID and the need for more adult intensive care beds. Many hospital pediatric intensive care beds have been converted to adult intensive care beds. And so there's a huge shortage of pediatric intensive care beds, and we're having a pretty bad flu season. It's spiking much earlier in the year, and we've seen COVID going up since Thanksgiving, and we're now going into Christmas and the New Year, so we expect to see it grow even more. There's still over 400 people dying a day from COVID in the US, over 65,000 people testing positive, but we know that's a gross underreporting, and about 35,000 people in the hospital every day from COVID.
I see. For Hong Kong, Dr. Jin, Hong Kong gradually opened up since the 1st of October. We have seen people have been quite cautious at the very beginning. Now the cases are really up, and yet we see the society going to somewhat a stabilized situation. Tell us more about what happened there.
So actually in Hong Kong, as I said, Hong Kong is still the safest city in China, that it will have the lowest possibility of any tsunami or explosive outbreak of COVID, because actually the general population already have a mixed type of immunity from both natural infection and vaccination. So the virus is actually, as you said, the COVID is quite stabilized. And RT, the effective reproductive number, is actually very low, lower than 1.5, always since May. So the cases are just not that high.
What do you mean by not that high? How did you get the number?
So we actually, our colleagues in the School of Public Health, they actually perform a prevalence study. They select 10,000 people each day, and then they do the antigen test, and it's all quite stable in the past months, and is around 1 to 2%, meaning that there are like less than 70,000 people infected at one time. So there are underreporting issues. So maybe there is one confirmed, whenever there is one confirmed case, there might be 2 or 3 that are already infected. However, the everything is still quite normal. And the people of Hong Kong have already accepted these. And from the prevalence study is quite stable, just slightly increased.
Yeah, of course, when it comes to medical resources, the city of Hong Kong as a special administrative region, one of the most developed areas of China, certainly have more resources than, should I say, inland China or rural China. So Chen, Dr. Xi, tell me more about how do you see the share of medical resources in China, and what does that mean, particularly for rural and also the less developed areas?
Yeah, this is indeed very important. As you were alluding to earlier, the ICU beds capacity in China has been increasing, more than doubling in the last couple of years. But I think the bottleneck will be more about the medical doctors who are trained specifically for the ICU beds services, and that may need more time. And I think it's key to try to keep those with the milder conditions or no symptoms to be at home. How well we could do this will determine how we can prioritize those very scarce resources to those really in need, especially the older adults and the vulnerable population. I think certainly vaccinations still need to do more, especially in the last couple of days. We see some momentum catching up, 1.01 million doses every day. That's very promising, but hope there's a momentum for a longer time. And I think effective communication with the general public is also very important. We see some panic buying of cough and fever medications, and the vaccine hesitancy, and some stigma towards people who are infected. But if there's a more effective communication about those things, it will get this wave of transmissions and surge smoother and give more resources to those really in need.
Images may appear to be identical, but looks can be deceiving. The difference is not always obvious. It has to be discovered. There are always different sides to a story. We put the focus on the details. To see more, to understand better. CGTN. See the difference.
Let me go to another point about the opportunities, quote unquote, well, challenges and opportunities of Omicron at this stage. It spreads very fast, contagious, and yet it is not as fatal as some of the earlier variants. Now, Dr. Tulenko, you've been following COVID and the discussions about that from day one. How do you see where we are together against Omicron for now? What do you expect might be some of the challenges understanding the future variants?
Well, I think looking at 2023, we'll probably just continue on a very similar course. So, with COVID gradually declining, but having spikes around holidays or school starts. I do think there is the risk that a more virulent a version that has a higher mortality rate appears. It's unlikely that one will appear that is more infectious, because the current versions are really about as infectious as a respiratory virus can be. But I do expect that we're still a couple more years dealing with COVID, and that's the best case scenario. I also expect, we've already had a monkeypox outbreak this year. I think the big question is what's the next outbreak, and what happens when that's layered upon COVID and the burdens that the health systems have been dealing with. It remains to be seen because, still every day, tens of millions of people across the world have COVID, and the virus is replicating in them, which is giving the opportunity for new variants. So we really have yet to see, and we're not done with COVID yet.
Dr. Jin, compared to earlier variant, how much opportunity do you think the current window is providing us to make the population at least somewhat more resilient to Omicron?
So actually, that's very important. As other speakers have pointed out, we need to work from two different directions. The first one is actually to tell the general public that this one is less pathogenic, and most people who are infected with this virus, 99% or even 99.5% of them, they don't need to go to the hospitals. If all these people rush to the hospitals just to get some anti-flu drugs, that will be a huge burden for the hospitals, and that will cause the collapse of our healthcare system. So on one hand, we need to do this. On the other hand, we also need to tell those high-risk people the red flag symptoms. For example, difficulty in breathing and continued high fever for a few days,
right.
Things like this.
Yes, because we are now in the middle of Omicron. It is different from Delta, for example, and some of the other variants. So how much of an opportunity do you think, a window opportunity, does it provide for health officials at different countries, including China?
So on one hand, for the Omicron variant, we need to do those different things. And also we need to take the opportunity so that if most people are infected with Omicron, then that will increase the immunity of the general population. That will make us in a stronger position to face any future variants that are still the SARS-CoV-2. Even if a more violent, more pathogenic variant will arrive, the general public will already have some immunity against it. So science tells us that this Omicron variant is specifically made to adapt to people who already have some immunity. So that will say that the virus will just be less violent. So we hope that the evolution of the virus can keep this trend. Otherwise, it will be a different virus. We need to prepare for other viruses. For example, SARS-CoV-3. We need to prepare for other threats, such as what Dr. Tulenko pointed out, the triple epidemic caused by influenza and also RSV. But the possibility that the Omicron variant will become more pathogenic, more violent, and kill more people, that's not a very high probability event.
There is a debate going on, Dr. Chen, about whether once being infected by Omicron, one is likely to have more resilience against other branches of Omicron or other variants of COVID-19. Now, tell me more about your thoughts, based on science, of course.
Clinical evidence from America shows that once people get infected Omicron for once, it's very less likely for them to catch the second time or third time. There would be some immunity, at least in the next couple of months. But I would be a little bit concerned.
Half a year, some people say. Half a year, some people say.
Yeah, half a year or even more than that, because that's the data we could get now since Omicron has emerged for just over a year ago. So we need to keep monitoring this. But I would a little bit concerned, but not too worried at this moment about a major COVID outbreak in China would have some unpredictable effects on the new variants, because given the most populous country and also a large number of people immunocompromised. So if they harbor the virus for months, that could produce some variants of concern. So we cannot rule out 100% about this possibility. But I think the monitoring and the testing of the genetics need to go on.
We have seen a lot of discussions about that in China. Whether this is the best window opportunity. Dr. Tulenko, what do you think?
Well, it seems the question you're answering, is this the opportunity to get herd immunity in China and just let everyone get Omicron, get that natural immunity?
According just one number to share with you, according to well-known and well-respected virologists in China, about 60% of the population are likely to be infected by Omicron in the next couple of weeks, around a month. And then very likely after that spike, we're going to see about 90% of the population being infected by Omicron. Well, that some of them could be asymptomatic, and some of them could have mild symptoms. Some of them could be in bad cases, but these are the numbers that the Chinese experts are providing to the public. So, Dr. Tulenko, your thoughts, just to reference to what you just said.
So certainly in the past 3 years, Omicron is the least pathogenic of the major variants. So if you're going to get one version of COVID, Omicron probably is the one to get. I mean, that being said, I'm reluctant to advise sort of letting COVID rip through a country, due to the threats to the hospital system, the threats to, basic keeping the lights on, things like that. So it's something that has to be handled very delicately.
That certainly is great advice. Let me also ask you about the future. Do we see preparedness for new variants or variant possibilities in terms of vaccines and also antivirus drugs? How much do we see research in those directions? Dr. Xi.
Yeah, I think we need to watch out for the new variants and keep doing the research and development for the new treatment therapies and the vaccines too, because the new variant keep evading part of the immune system. But I would also emphasize we should also build a medical triage protocol, especially in a hospital system like China, because China is more hospital-dominated healthcare system. When people get sick, they usually seek care, which may put tremendous pressure to the hospital healthcare systems. Especially you were mentioning about perhaps we will have more than one wave of the virus outbreak in the future, since happened multiple times in many other countries. So we have to prepare a very sustained and non-pressure towards the healthcare system, try to relieve some of the burdens. Looking forward at 2023, I think the first thing may happen, we need to watch out, is the holiday travel. So people returning home. So the next 2 weeks will be the golden time for people to get vaccinated. Building immunity will take 1 or 2 weeks if people receive inactivated vaccine. So how to avoid bringing the virus to their family members, especially in the Western and Central China rural areas. Those are areas with more older persons and with less advanced healthcare system.
Dr. Jin?
So I think reduction of severe cases and reduction of deaths should be put as the priority, and everything should depend upon that. Whether our hospital system can sustain the impact. So that is a very important factor to consider. So whether there would be one major wave that 60% of people got infected, that's still to be determined. And it depends on how people see it and how people do to prevent the transmission, for example. So in Taiwan, from May to December is all very high. And in Singapore, there are multiple waves. And the first wave is actually a little bit bigger. And then the second and the third wave is only half of the first wave. In Hong Kong, we have the tsunami from February to April within 2 months. And during this period, maybe 50% of people got infected. And then after these, we have very, very small spikes, which is only 1/10 of the major peak until now. It is very, very continuously is where the virus is of very low activity. And this is actually the ideal situation.
So if you were being asked to be the advisor for the health authority in China, what is the most important tasks do you see that the country will be handling with care in the next week or two? Dr. Jin?
Vaccinate the elderly, stockpile some antivirals, and do the best to protect the hospital system. And most importantly, to educate the general public and to explain the rationale of the new practices.
Dr. Tulenko?
I think it's, I agree with Dr. Jin. I would put it as sort of being two-pronged. One is on prevention, making sure everyone has sort of their self-protection plan, particularly the elderly and the at-risk. How are they going to protect themselves? Vaccination, isolation, masking, hand washing and hygiene. The other is treatment of people who are ill. And as Dr. Jin said, you need to stockpile antivirals and actually just general medicines, as well as making sure you have enough beds and enough health workers to handle the waves that we're going to see.
A laundry list of tasks, certainly. Dr. Shi.
Yeah, I totally agree with both of you. And I also believe that the key will be the flattened curve, not to get infected all at the same time, to get the healthcare system some relief without being crashed or in a very large strain. And I think importantly, the government, the health authorities may have established some key criteria to look at, like ICU occupancy, vaccination rate for older adults, and have some phased reopening. So when things get better, you can accelerate the reopening. But when things get a little bit worse, can reverse back and slow down a little bit. Try to have a more sustainable, smooth reopening.
Jin Dong-Yan, Chen, and Kate Tulenko. As always, thank you so much for your insights. All the best to you and your loved ones. And that's all the time we have for today. If you'd like to know more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei on behalf of the team. Thanks for being with us. Bye for now.